We live streamed our patient participation group meeting using Facebook Live. The live stream video has been watched over 2,000 times, and during the meeting we received a number of comments from patients watching our Facebook presentation. Patients have also commented after the meeting, as the live stream is still on our Facebook page, and we responded to all those comments that patients have made. Basically, some of the comments we replied to, we've got really positive feedback from those comments we made. We decided we were going to do it and then picked a date. We sought some technical assistance from John, who's here today. John's a civic storyteller, and he came down and filmed our live stream. I don't know whether you've seen it yet, but the live stream's got multiple angles in there, and it's great. We sent letter invites to all our PPG members. We publicised the event on our Facebook page, and we also boosted our post. Having a physical meeting kept things fluid, so you may be thinking, if we had a patient participation group meeting and we stream it live, we could potentially just have members of staff there presenting to people. We actually thought create a focus for the people watching online, and it created that sort of physical focus, and it also created a meeting where there was a context of discussion, where there was interactions with people. 20% of the patients who watched our live stream were over the age of 65. The highest age group would be between the ages of 55 and 65. But under 21-year-olds accounted for less than 5% of people watching it. So I'm thinking, what do we need to do now? Look at Instagram, look at stuff I probably don't know about, but the teenage niece does.
To be very honest with you, I was a little bit jealous about it. I thought it was absolutely fantastic. It's so bold, it's so innovative, it's captured, it's trying to embrace the digital market, like you're saying about your age group stats. Us oldies are the people who sort of like watch stuff like that on Facebook, and we've got stuff to say and relevant stuff to say as well. So yeah, I thought it was really good, well done.
I think,
I'm going to give you a round of applause.
Self-care could be making a massive amount of difference to the healthcare system. For example, if people were looking after themselves better, maybe some avoidable illnesses, if they were managing their own conditions better, then all of which leads to less pressure on the healthcare system, less face-to-face, and in some cases less reliance on medication.
So the vision of the Digitising the Red Book is to keep children safe and well, and to know where every child is and how healthy they are. And it's to enable coordinated, proactive care and for the appropriate access to all information for all those involved in the care of the child. And it starts a generation of digital wellness. The move to Digital Red Book heralds the first generation who've only ever had a digital record, and that's amazing.
But it's all about sort of collaboration. So collaboration in terms of delivering the services, so all of those different partners, but also inclusion, so making it available for all different people, whether they're older people, younger people, people with specialist requirements. Typically when we've shown sort of younger people health services, they've found it quite boring. They don't really want to, even though they use a lot of digital services, when it comes to health they don't care because they don't use them that much. But it actually sort of got them sort of a bit more excited. They actually saw the interface and thought something different here, and they could get it and they understood it really quickly.
It's all about how can we do that to empower our people. So really we're keeping our people at the heart and centre of everything.
So the Digital Pioneer Scheme applies to anybody working in health and social care in the area.
Including those in the grey boxes, so the third sector in care homes and support staff are as important as the people who are in the system ourselves. And often one of the biggest barriers is, I didn't know I could do that. I didn't know I could access my records online. That would be so helpful if I could. So we've been trying to find out what people don't know so that we know what we need to empower them and the information we need to give them moving forward.
With my doggy, who is currently in daycare today, I get pup dates. I can get a pup date. I can then use my WhatsApp video to have a look at said pup and make sure she's okay and all is well. Can we do that with our doctors or our nurses? Not yet, but I think it's coming. It is coming, and we need to ready ourselves. We have got different toolkit these days. Let's use it. Let's do it together. Let's not be scared. Let's go through the barriers together.
If I had to say what my long-term ambition would be around this, is I'd see advice and guidance as just a stepping stone to something a lot more challenging, something much more a robust virtual anchor point for people's shared care records between primary and secondary care, where we'd involve the patient in the discussion. They'd be part of the system.
And if you want us to come into your practice, as we've done recently in other areas, and do a bit of engagement with your patients, then we've got that offer open to you.